Well, we have had plenty of hot days already this summer, and joining us today, he's an interventional cardiologist at Mercy Health St. Rita's, Dr. Sandeep Patel, to talk about the heat in your heart. So thanks for joining us, doctor.
Hey, thanks for having me.
Okay, so we have had some really hot days already. What kind of heat-related illnesses with your heart can impact your heart?
Yeah, that's a great question. So although summer's here and we're kind of all out and doing things, we have to be wary about the heart and what the heat can do. First and foremost, obviously the heat's going to cause you to get dehydrated. So being out, you need to stay hydrated, but it's within reason. Some of these heart patients have issues with volume and taking in too much fluids, and so they need to really be aware of how much fluid they're losing or how much fluid they think they're losing and trying to stay even for the day's balance. The second thing is as we get hotter, our heart rates tend to speed up. And so that can cause people to have arrhythmia issues and feel palpitations and things of that nature. And then rarely, but it does happen, people do more things when they're out. So they're exerting themselves, they're pushing themselves, they're playing sports. And in those scenarios, people can start to have chest pain and discomfort. And we even see heart attacks related to this. So it's so important to listen to all the signs that come from your heart and talk to your providers and your primary care physicians about any kind of abnormalities that you may be sensing while you're out there having fun.
All right, if you already know you have heart conditions, are there certain things that you should avoid and just not do?
Oh, that's a great question. I guess a lot of that depends on the type of heart condition you have. If you're talking about heart failure and you're getting dehydrated and you're taking water pills, it's probably one of those things that you need to really be aware of before you go out there and start running a marathon. If you're dealing with severe blockages in your heart and you know that you have these issues or bypass issues in the past, then probably getting on a riding lawnmower or pushing a lawnmower while mowing the lawn for a couple of acres is probably not the best way to go. So some of it's common sense, some of it's mainly driven by what you and your providers have come together to form a plan regarding your heart health. But a majority of it can be predicted based on the kind of the etiology of your heart condition.
You're talking about staying hydrated. Is water the best thing, or should you go for some of those, like Gatorades or whatever that have those electrolytes and stuff?
Yeah, so both those things are actually very well used in the community, and I think either one is fine. But again, it's those cardiac condition patients that we worry about as their electrolytes do get an imbalance, and we're already putting them on electrolyte replacement therapies, including potassium, magnesium, and calcium. And so if you're going to do something like that, that's something you need to talk to your doctor about. Otherwise, just regular water is usually the best.
Now, you mentioned that sometimes you might get chest pain or stuff or something like that when you're out. Are there other signs that we're like, okay, maybe something is up with my heart, that, I'm out here in the heat and things are happening? Are there any other signs to look for?
Yeah, I really tell the patients that come and see me about palpitations. A lot of times they'll feel skip beats and rapid heartbeats, and that can be their first sign that they're getting dehydrated or they're basically they're revved up too much and they need to take a break. And so I would use that as your primary kind of symptom. Shortness of breath is always in the background, and lightheadedness and dizziness also come with dehydration and feeling tired in the heat. But in general, most of the patients that are out there in the heat are going to feel this fatigue and palpitations it's going to tell them to kind of stop and take a break for a second.
We've had a lot of 90+ degree days, even 100. Is that the kind of heat we should worry about? Or even like in the 70s and 80s, heat is heat and just you have to worry about it no matter what?
No, everybody has their own tolerances for heat. So obviously then the 85+ days when you're out and about, those are the days that I really would concern myself with. But the standard 65 to 75, those are really normal ambient temperatures for the human body, and you should be able to tolerate that. So I would be really more wary about those days where it's extremely hot, especially if those days come consecutively and you're out multiple days. Most of the patients that have these conditions, when the summer comes, it's their time to get out and about. But then there's all these other factors that come into play in terms of where they are, how long they're out, and what they're intaking at the same time.
So obviously this is one of those situations that if you're feeling something, those palpitations, the pain, you get yourself to the doctor right away?
Yeah, or at least notify someone. A lot of the times, these symptoms will resolve with just going back inside, drinking some water, sitting down, and taking a break. But if it's a recurrent thing, or the symptoms are not resolving when you've actually abandoned the heat, then it's time to either call someone, get help, or discuss it with your PCP.
All right, things we need to know about our heart health and the heat. Thank you very much, Dr. Patel, for joining us today.
Thank you.
All right, don't go away. Noon Edition continues in a moment.
This amazing and beautiful campus